Mike Morin, the Township Fire Chief. And hey, Chief, you got Matt DeRousse with you as well there. I got to hit a button or two. Matt, welcome to the Megacast. Good to have you with us.
Good to be here.
So, Chief, please start over again because we couldn't quite hear what you were saying earlier.
So I think the last time we spoke, this was just ramping up in regards to COVID. We had a lot of plans. We talked about plans A, B, C, and D, and we were working on C. So at this point now, I think with the help of a lot of the individuals here, both police, fire, our other employees, DPW, we've got our plans in place. The residents have certainly helped us out by staying at home and following the rules. So I know everyone's getting a little cabin fever now, so it's getting a little bit tougher to wrangle the cats around, but we seem to be holding our own at this point.
And we doing okay on calls? Last time we talked, you told us that overall, at least the police folks have been saying overall calls are down because there are fewer people on the roads. Are you able to keep up? And maybe I should send this over to Matt sitting next to you, Matt DeRousse. Are you able to keep up with the calls, primarily the health calls that are coming in from 911?
We are. We're doing well. We do show a reduction in our overall call volume. We're still running COVID calls every day. Those have seemed to go down a little bit as well. So as of right now, we are maintaining and doing well.
So I just want to ask you guys one more time, both Mike Morin, the Bloomfield Township Fire Chief, and Matt DeRousse in Bloomfield Township. Are we seeing, you're on the front line, are we seeing the curve flatten in Bloomfield Township and in our area? Matt?
I think so, yes. From all evidence, just with a consistent slowing of the runs that are anything even COVID positive or a suspected COVID, it seems to be that we are on that downturn. So that's positive.
Chief Morin, do you have anything you want to weigh in on that?
Yeah, we've been watching this obviously from day one. Right now, we're watching the zip code areas, and we're going up about 1% a day, but there's a lot more people being tested. So right now, we're about 352 confirmed in the township by the zip code. If you go to the county website and look at that information, and we've had 22 confirmed that have passed away from COVID. Obviously, the numbers are higher than that because a lot of stuff isn't tracked, but this is just confirmed that they've been tested, and they tie it back to the zip code. So we kind of watch that. Again, that includes Bloomfield Hills as well as Birmingham and some of those zip codes, but our four zip codes that we handle, we're up to about 352 confirmed cases. We have had one case in our department with one of our firefighters. It was not from a response here, but from family member. He's doing well, his mom's doing well, so we're glad to hear that. But it's starting to hit home with people. They're seeing relatives that have been through the process, either in the hospital or rolled it out through home. But it is obviously local here. We want to keep everyone in tune with, again, staying in compliance with the rules, the distancing, the mask, and we've tried to stay 6 feet apart here. We work together every day, and we do temperature checks every day with that. But, following the guidelines, I know it's rough for a lot of people to do that, but, stay compliant and we'll stay healthy.
No, I know you guys have been doing your social distancing, and I screwed that up by, having a Zoom issue here. So thank you very quickly. We'll get you guys on your way, but thank you very quickly. So there is now new testing, and any first responder in Oakland County can immediately get tested, even if they don't have any symptoms, think they're asymptomatic. Is that helping out either one of you when I respond to that?
Yes, it is. It's been a real big help. We have, even with somebody that has maybe a mild symptom or a question, they talk about the worried well. This has given us a big opportunity to get them in right away, get test results back fairly quickly, and then we can clear them back to work. And initially, when this first started, we would be waiting 7 to 10 days to get somebody cleared.
Right.
And this has just been a big help.
Well, no, then you wait 7 to 10 days, and that's 7 to 10 days of exposure. You just don't know. So That is absolutely huge. Matt, the EMS captain, Matt DeRousse, is joining us along with Chief Mike Morin from the Bloomfield Township Fire Department. Matt, back over to you again just for a second. We are hearing that that hospital workers, doctors, ER folks, the nurse practitioners, they've come up with a lot of new strategies based on communications they've had with their colleagues around the county and around the country, and procedures that they have figured out through this. Is the same thing true with the EMS workers? Have you learned some things over the last 30 days that are helping out?
We have. We've learned a lot of things. The one thing that we learned is we were prepared early, and we came up with the best plan that we thought we could at that point. And it turns out it was a benefit to be that far ahead. But the other thing that we did learn is we need to change that plan almost daily for a while as things unfolded, and we had to make adjustments to our plan. Now, after this 4 or 5 weeks of operation, we've got it pretty streamlined, and now it's just a matter of sustaining this operation for the long haul.
One of the biggest communities that we need to serve here in our lakes area, and actually all across Oakland County, are seniors. They're the most vulnerable. It's been difficult to get specific information from nursing homes. Now the state health department says they're going to start publishing that. Chief Moore, do you think that'll help out so we have a better idea what's going on in the nursing homes?
It'll help out globally. I think here we've monitored it. We not only consider the nursing homes, but the independent living homes as well. We want to keep it out of there as much as we can. Obviously, we've got it in one of our facilities, and we've monitored that. We respond there just about a daily anymore for various reasons, but it's here. We know it's here. We want to keep the spread minimal, obviously, so that people can get the proper care at the hospital in regards to having the continuum of care that they're going to need to get them healthy again. So we know it's here. The numbers will just validate that. It'll show us maybe more of our hot spots that we need to focus a little more effort on. But in Bloomfield Township, and I think most of the communities around us, we spotted it early, and we've tried to put things in place to manage it. And we'll just continue to deal with it as it keeps popping up.
Well, great work, and you are right, and we've seen it in almost all of our communities. Having a plan early, responding to it, not ignoring it, not letting it sneak up on us, I think proved essential here. And we've been hard hit in Oakland County. Let's not kid ourselves. This area has been very hard hit, and the job you guys are doing and the others are doing is absolutely amazing, and it's greatly appreciated. Now. I thought you said it really well, Matt DeRousse. Now we're coming into a new phase, and you got to come up with a new plan almost every day, right? So we're going to probably hear that construction is going to begin soon, home construction. That'll have a big impact in your communities. We got people out on the golf courses, people out on boats. Retailers are beginning to do curbside retail. Grocery stores are opening up, and the governor says, oh, that's good, but put a mask on. So as our community and society begins to open up a little bit, what concerns do you guys have? And Matt, I'll start with you. And have you had to adjust your plan one more time?
Yes, because shortly, once the public the stay-at-home order is lifted and the public is out and about, our run volume will go back to normal, and it'll go back overnight. So the first thing that we have to do is be very disciplined and stay within using our proper PPE, because we're going to be running on a lot of people that are not associated necessarily with shortness of breath, fever. They may be car accidents and other things, but to protect ourselves and them, we still have to use proper PPE. And that just means we're going to be using a lot more than we have been. Also, we just have to be consistent with the training and the knowledge that we have. We're still going to have people that are going to call that have symptoms, and I mean our employees, they're going to get sick as the year continues on. We have to continue to screen them, continue to be diligent at the stations and around one another so that we don't bring anything into work, because very quickly it could go through our department and render us fairly useless if we have half our staffing. So yeah, we have to be very aware of this is going to be here for a while, and we still have to be vigilant.
And Mike Morin, I assume you're talking to Greg Flynn and the chiefs and the other departments around the area, and you all have each other's backs. I mean, if one department were to, see a lot of people go down with coronavirus or anything else, I assume that the other departments would be there to help out. Is that correct?
Yeah, and they have been. We set up the 5 different divisions in Oakland County. We utilized it the first week quite a bit. We've got different plans in place now with private ambulance and bringing resources to where they're needed. So as we move forward, we'll keep the divisions going. The county's kind of prepared as a group instead of us all being in our own little silo. So if I need help, I just pick up the phone and let them know. We have command groups that talk every morning that talk about, who's off sick that day and what the manpower is as a division, so we know what our status is and where we're trending up or down as far as employees. We still have our helplines in place for the township residents themselves. So if there's things that you can avoid going to get medications and things because you are high risk, just call our helpline. The residents have utilized that quite a bit for prescriptions and groceries. Also, a lot of the CVSs and things are delivering prescriptions themselves to help along with that. So, as a response, Bloomfield Township works with the communities around us. We watch each other in regards to the increase or decrease of this, and we'll be there to support each other should we run low on manpower or equipment. Or again, we're here for fires as well. So Southfield had one last night that we helped them with to spread the resources out as well to maintain a good response for everybody. So.
Well, great job, gentlemen. Thank you very much. Thanks for joining us. I don't know. I hate to put you in the spot. Do you have that helpline number there that I can share? Can we get that later on, Chief Morin? Do you know that helpline number we could share with the viewers right now if they need a helping hand? We'll get it. All right, we'll get it. We'll get it up on our website. Sorry to throw that at you. Great job, guys. Anything else you want to conclude with?
No, I think that, moving forward, this is not like, let's shut off the light switch tonight and it's over with. This is a long-term event for us and, the citizens out there. So be vigilant. Remember that mask is to keep you from spreading it to someone else. It doesn't necessarily protect you like an N95 mask does when you're fit tested. So wear the mask, protect other people. That's what we're trying to do this for. And then, be respectful. As everyone gets the cabin fever and wants to get out and they're anxious. When you're driving back to work for the first time, then be respectful of other drivers and stuff and try to maintain some composure as we go through this, because it's going to be a long summer dealing with this event. But I think you've got it under control. We just don't want to see it spike again.
Matt DeRousse, EMS Captain, any thoughts from you before we say so long?
Well, real quick, I do have that helpline.
Okay, so we'll take it.
Bloomfield Township resident helpline is 248-723-3455.
Okay, 248-723-3455, and that is in Bloomfield Township, and we have a lot of the other numbers, Oakland County number, the other municipal numbers are all on our website, and we will add that one as well. Gentlemen, thank you very much. I appreciate you joining us this morning on the MegaCast. Good to be in touch with you. Thank you again on behalf of all of us for your fine work and your bravery out in the field. Greatly appreciated.
Thanks for getting the message.
Appreciate it. There they are, a couple of our first responders. They are the heroes right now, my friends, doing the good work.